I'd like to extend a special welcome to all of our witnesses, and especially Dr. Carla Denise Edwards, a fellow Georgian, who I will introduce later. As Congress considers health care reform legislation, health information technology will be an important component of that effort. This is a critical issue for the medical profession and particularly small medical providers. Some studies estimate that 75% of practices in the United States have 5 or fewer physicians. Health IT is a useful tool for the management of medical information and its exchange among patients and providers. This technology can help to reduce errors, better manage chronic diseases, decrease paperwork, and increase efficiency. Despite these benefits, fewer than 1 out of 10 small medical practices have fully electronic health records. Barriers to small practices adopting health IT, such as cost and the risk of purchasing systems which may become obsolete, remain. This year's stimulus legislation included ambitious goals for the adoption of health IT. It established Medicare incentives to providers who demonstrate meaningful use of health IT and penalties for those who do not. Strengthened the HIPAA privacy rule, which, by the way, is one of the biggest reasons that health care is so expensive, according to a lot of the providers I've talked to, and created a new patient right to be notified in the event of a breach. The Department of Health and Human Services will issue regulations regarding to that law. As we move forward, we hope that small manufacturers of health IT systems and their users, as well as small practice physicians and hospitals, will be included in that dialogue. The National Coordinator for Health IT, in consultation with the HIT Standards Commission, has been drafting standards in the certification for health IT. We are awaiting a definition of meaningful use, as this definition is critically important to those people providing. In addition, while I believe that health ID has many benefits and we should encourage its adoptions, small providers are concerned about the interoperability, privacy, and security standards, and the fact that the HIT funding has not yet begun to be distributed. It is important that these concerns be considered. Finally, I want to add a word about the health care reform generally. Small companies are struggling. In a difficult economy, they are doing their best to stay in business. A mandate that employers must offer health insurance will simply add to their already stretched bottom line. I feel strongly that exempting even some small firms will be an invitation to Congress to go back at some future point and include more of them in the mandate. And I am concerned that a national government-run health care system could drive private insurers out of the market, reducing competition and raising cost. Everyone in this room has been a patient, and everyone understands that for privacy and for respect of medical information, the most important issue for health care reform should remain the doctor-patient relationship. I would hope that health care reform will acknowledge this fact. Madam Chairwoman, I appreciate your calling this important hearing, and I look forward to hearing the testimony